Welcome to the Social Worker Rants podcast, providing a platform for social workers to share their stories. The podcast covers a wide range of topics, including mental health, social justice, policy, and the day to day realities of the profession. Season 10 will continue to focus on the intersectionality of mental health and finances. Hope you enjoy. Social workers, mental health professionals, and change agents. What's going on? Welcome to another episode of the Social Work Rants podcast. I'm your host, Bash Moreno. Saludos a todos. Greetings, everybody. Thank you for tuning in, tapping in wherever you are watching or listening to this podcast. Appreciate all the love and support. Gracias a todos por su apoyo. Yeah, this week's episode, we're going to talk about the what Agent Orange calls it the big, beautiful bill that the House passed on May 22nd and how it affects social work. So, before we get into it, this episode or the podcast is not to be used as a substitute for individual therapy, counseling. If you need to talk to a therapist, call your psychiatrist. If you don't have one, call 988 911. Go to your nearest emergency room. Get the help that you need. Is okay not to be okay, but definitely get the help that you need for my out of the country and listeners. Whatever your emergency phone line is, do that. You call that number whenever you get a chance. Yeah, and this episode is brought to you by Bass Moreno Consulting, providing financial education and counseling for people of color in the sandwich generation who are struggling with their finances while caregiving for their loved ones. If that is you, I'm hosting a free 45-minute consultation on how mental health is affecting your finances or how uh, your finances is affecting your mental health. So, vice versa. So, yeah, you go to bassmorenoconsulting.com and schedule your consultation. So, yeah, back on a couple weeks ago after this recording, the House representatives made a vote, and it was 215 to 214 vote. So, yeah, so the House of Representatives decided they want to cut Medicaid, want to cut food stamps, um, give tax cuts to the ultra wealthy, continuing the 2017 Trump tax cuts. So, if you remember filing your taxes anywhere from 2018 to 2020, 2021, and your chances are, unless you had a business, chances are you got less of a tax refund than you did prior to Trump taking office. Um, so I'm going through my phone real quick because I found a site that kind of gave like a good breakdown of all that this bill entails. And by the way, it still has to go to the Senate, has to vote on this, and if it gets approved, which knock on wood, it doesn't, then the president signs off on it and it becomes law. So, how this affects social workers? So, pretty much for those who have Medicaid, they want to implement work requirements for Medicaid recipients without children under the age of 7 and those age 65 without disabilities. Um, just work requirements in general is hard as it is. I know I think President Clinton started doing that under his administration. So um, many of Americans who are getting low wages are already on Medicaid and already qualify for Medicaid. So it's interesting to say the least. Increasing the frequency of eligibility checks. So that's when the annoying issues start happening, like constantly requiring documentation to remain eligible for benefits. Like I already did this, I know in the past people had to like recertify, twice a year. Then it went down to once a year. And sometimes people forget or they get notifications and then they wait last minute. I was about to get cut off, like forgot to recertify. So increasing these frequencies is just going to be more of an annoyance, more of a nuisance for folks. Cutting federal funding to any state that provides healthcare coverage for undocumented immigrants via Medicaid infrastructure. Now, this is effect would affect, and I'm only speaking for me, uh, from a social work perspective. I used to provide case management services for undocumented adults living with HIV. So that was the program I worked at. Not everybody was undocumented, but we had a good amount of patients, adults living with HIV who are undocumented. Many of them are Haitian, and many of them are Latino, Latinx. And so immediately when Trump came into started this new reign of terror that he's on now, I thought of my previous job and kind of a definitely a blessing for me that I'm no longer work there because it'd be tremendous, even more stress than I was already on. And but everything Trump is doing is hurting a lot of folks. So and and we'll continue. Um, Banning Medicaid for covering gender affirming healthcare for both children and adults. Um, so that for my LBGTQ folks, by the way, June is Pride Month, so happy June. As of this recording, if you listen to this recording in June, which is a couple of days away as of this recording, happy Pride Month, and there's a lot happening right now regarding that. So, Trump saying there's only two genders and all this other nonsense. So, uh, definitely the continuing attack of the LGBTQ plus community, and on top of the caregiving community with all these potential cuts to Medicaid. Cutting Medicaid funding to organizations that provide abortion care, including Planned Parenthood. Planned Parenthood has always been an attack for many many years, um, and roughly supposedly this bill cuts Medicaid by roughly $700 billion over 10 years. So 2028, whoever the president is, if we get that far to even have an election, got a lot of work to do, and if these cuts go through, and I don't know how these cuts get reversed, honestly. Modifying food snaps, the SNAP benefits, raising the upper age requirement for adults without children to qualify for the SNAP benefits from 18 through 54 to 18 to 64. Work requirements. Parents of children ages 7 to 17 must work 80 hours a month in order to qualify for SNAP benefits. In households where parents are married, only one has to work. The bill limits states' ability to exempt individuals from SNAP work benefits. So, what happens to folks who are disabled and can't work? That's my question to that. Requiring states to pay a baseline of 5% of SNAP costs beginning in 2028. This bill cuts SNAP program by about 300 billion over 10 years. So again, it goes back to 2028. And who knows if we get that far, who the president might be. Um, who knows what's going to happen by then. But yeah, these cuts are going to hurt folks. If you work with kids, you work with older adults, um, you work at a program that you bill for Medicaid, um, How are you guys? Are you guys even talking about it? This in your agencies or administration higher ups having these conversations with staff? What to look for? What to kind of game plan uh, for these potential cuts? Now, as we continue, I'm trying to go through the meat and potatoes of this bill that affects uh, potentially could affect social workers. All right, we're talking about immigration agenda. Obviously, we see all these videos online and on the news regarding ICE invasions and people getting taken away without due process and things of that nature. Shoot, even like social work organizations, nonprofits hiring or try to hire social workers to work for ICE. Um, so here we go. $4.6 billion to continue construction of the border wall, and that wall's been a complete disaster. That's been a failure. $45 billion for ICE detention centers, four 14.4 billion for ICE transportation and removal operations. I know there's an airline called Avelo that's popular in South Carolina and here in Delaware where I'm at. They're doing detention flights, so there's been like a little boycott or at least a lot of protests against that airline. Um, 8 billion to hire more ICE agents and personnel. 5 billion for improvements of CBP facilities. 4.1 billion to hire more border patrol agents and other personnel. So just the country has always been about protecting, national security, things of that nature, right? That a lot of money goes into that, and that's the American way. Unfortunately. And here's if you work with immigrants, and this is a kicker. Like I know there's a little, you know, potentially a lot of Cubans, Haitians, people from Nicaragua, Colombia, Venezuela, going to be losing their protective status potentially, and asylum seekers to pay for protective status. There's money, and I know working with undocumented clients that had temporary status and try to pay those fees or come up with the money, well, those fees are about to increase if they haven't already, and which includes $1,000 asylum application fee, $1,000 fee for individuals paroled into the U.S., $3,500 fee for sponsors and of undocumented children, unaccompanied children, $5,000 fee for sponsors of unaccompanied children who fail to appear in court, $550 fee for work permit application, must renew every 6 months. So that's, do the math here, that's $1,100 a year. And a lot of folks don't even have the 550 fee to pay. $500 fee application fee for temporary protected status. That's a huge one in the communities I used to work at. $400 fee to file a diversity immigrant visa application. $250 fee to register for diversity visa lottery. $250 visa integrity fee. $100 year fee while asylum applications remain pending. $100 fee for continuances granted in immigration courts. $5,000 fee for individuals ordered removed in absentia. I'm not even sure what that means. So yeah, just all these different fees. Definitely read up on this, um, especially if you have undocumented folks on your caseload, you work for organizations, or people who work in this work with this population, definitely look into this bill that was passed in the House. I'm not sure where in the Senate is due to vote on this, but this the anxiety is building for this possible to pass. I want to talk about student loans real quick. Ending the 2023 SAVE loan repayment program, replacing it with two other repayment plans. So if you had student loans when COVID happened and they put you in forbearance and Biden came up with the SAVE program and you got approved for the SAVE plan for at least like that year and change, and then obviously Trump won, and he's president now, and there was going back and forth regarding the SAVE program. So the SAVE is kaput. I've mentioned this on a couple of episodes regarding student loans. The SAVE program is done. So here are your two payment options if you have student loans. Number one is called the Standard Repayment Plan. Borrowers will pay back their loan at a fixed rate each month. Loans up to $25,000 will be paid over the course of 10 years. Loans up to $50,000 will be paid over 15 years, and loans up to $100,000 will be paid over 20 years, and loans over that amount will be spread out over 25 years. As for the standard plan. The other plan is the Repayment Assistance Plan, or acronym known as RAP, RAP. It allows borrowers to make their monthly payments based on income, almost like an income-driven repayment plan. Borrowers pay rates based on their annual income, which ranges from 120 per year to those making less than $10,000, divided up into $10 monthly payments to 10% of gross annual income for those making over $100,000. A little confused by that, but those are your two options. It ending current rules that allow borrowers to temporarily have their loans deferred due to unemployment or economic hardship. That is a kick in the ass right there. And also eliminating students' access to Pell Grants if they're enrolled in school less than half the time, and raises the necessary number of credits taken per year from 24 to 30. More changes to federal student loans. Capping the amount of federal student loans that parents and students can take out. For students, the max is $50,000 in total undergraduate loans, $100,000 or $150,000 for graduate and professional programs. That's MSWs and DSW programs. For parents, the max is $50,000 in total in federal loans to pay for their children's education. This applies even for parents taking out loans for multiple children. Ouch. There goes people in the sandwich generation that I help in my business who may have multiple children in school. Under the bill, students and their parents cannot borrow more than $200,000 total, including both undergraduate and graduate loans. These limits will take effect July 2026 if the bill passes the Senate. Interesting, to say the least. And it goes into like green energy tax bills. So like if you own a home and doing anything to like save money, electricity that's going away, uh, you know, getting electric vehicle tax cuts that's going away. So, yeah, so a lot that affects people's pockets, and this may you may work at a program or agency, or you do private practice, and you may have clients not affected by any of this, but which is good for you. But those who, and I mentioned it a while ago, um, I expect, and I could be wrong on this, but I expect many people who have a private practice going to be doing a lot more case management things thanks to Agent Orange and his goonies and his plans. It's already passed the House, so um, call your senators and tell them if you don't like this bill, tell them they need to vote no, and expect a lot of to be doing a lot of more, have more case management conversations, and a lot of nonprofit agencies losing federal dollars that they normally would have gotten and don't have the funds to pay folks, whether it be electric bills, gas bills, whatever bills, housing, things of that nature. So the struggle is real in these streets, is not really talked about day in, day out. I mean, I see the struggles with these nonprofits here in Delaware, and I'm sure throughout America, like nonprofits are struggling and trying to figure out what is happening in return in terms of this administration, and a lot of people are currently in limbo right now. So, um, yeah. So this bill is not beautiful whatsoever. I don't care what the president got to say. This big, beautiful bill is an atrocious, disastrous bill that's going to affect millions of Americans and affecting their healthcare coverage one way or another. So, um, and on that note, this is why social workers we gotta care, because many of us are working agencies that get Medicaid dollars somehow, some way. Or I know I used to, many of my jobs for many years relied on Medicaid dollars, not only pay for my salary but make sure just having a job at hand, programs being run. So um, yeah, it's important, and we need to pay attention to this. That's it for today. Make sure you follow the podcast on Instagram at the Social Work Grants Podcast. Shout out to everybody that's been listening or watching the podcast on the YouTube, the podcast. Shout out to FeedSpot, again in the top 10 of all social work podcasts, and that's thanks to you, the viewers and listeners of the podcast, who's been supporting for these 5 years. Till next time, take care, folks.